Dr. Sarka, would you please come to the table, and we will have a short session for quick questions and answers. Sure. And then we will obviously have more time during the final discussion. So thank you for the presentations again, and now I would like to ask the audience, both the speakers, to give your questions. I'm sure that you have some nice comments. Professor Herrick.
We've always heard about how MRIs have a waiting list in Canada, but MRIs are cheap. I can't figure out why, of all the things you would ration, why ration a cheap diagnostic service? It just doesn't make sense. I mean, I can see why they would delay orthopedic surgeries, but MRIs are, I mean, you can buy those machines economically.
I'm with you 100%. I wish we'd have more MRI. Certainly would make my life easier. The problem is budget. Number one, when you build an MRI, you have to maintain the MRI. And I've told you before, one of the groups of people you haven't seen up on that list are the radiologists. They make money hand over fist. And what happens is you have to pay them to read the MRI. So there's all the other things that go along with it, and they don't want to do it. In one of the neighboring towns, there was actually a fundraiser. They fundraise money for the MRI. They have the money. The government wouldn't allow the building of the MRI. Very good question, but I'm telling you, it's government run, privately delivered.
Yes, please.
I have a remark and a question to you. My remark is that my first slide said that it's difficult but not impossible to measure quality and output of healthcare. And you showed exactly what it is, because your figures were completely different compared to mine. According to the McMaster measurement, the best healthcare on the whole world is in the United Kingdom, and very extremely few people in Europe believe this, because England has fantastic hospitals and fantastic specialists and extremely bad places with extremely high levels of resistant bacteria strains and nosocomial infections. And this is exactly the exactness of the measurement that's needed. England can, under any circumstances, be the leading word on the world. Sweden was, according to you, number 3, and I don't believe it. And Holland and some other countries were far below. And that's why you have to choose more criteria. And my question is that one of the problems with the boundless computerization is that we have always more and more extremely sensitive data on our patients. For instance, we pediatricians, we use very much the whole genome sequencing. And what happens if I find out that my 3-year-old patient has a Huntington chorea? Will it be spread to all the places? As far as I know, the United States has something that, as far as I know, is called Personal Integrity Act, that your genes belong to you and nobody else is entitled to know anything about your genes. Have you solved this problem?
With the electronic medical records, I know when it was implemented, and I was involved with the initial implementation, and we battled over and we had long thoughts as to what to include and what not to include. Because what happens, for example, with, let's say, give an example, mental health. If I send somebody to a cardiologist, does he have to know that this particular person had a depressive episode 5 years ago, or he, attempted suicide? So we're battling this. But what we do collect are filter data about the diagnosis and so forth. I don't know if that answers your question. And with respect to the study was done by the US, even though it's called a Commonwealth study, and they came up with the numbers. I, like yourself, was very surprised to see the numbers for 2 reasons. I was surprised how badly Canada did, and I have a number of colleagues from the UK, and they tell them it's sort of a similar story. They were very surprised that they're number one. I think it was based on a whole host of different things, and the way the study was done, I think it was done by a questionnaire, and the feedback, perhaps maybe you would know more than I do on that. That's why they came out number one, and that's why we came last. I was just as surprised of us being last as UK being first.
Yes, please.
Thank you. My name is Sándor Kerekes, and I happen to be from Toronto. And in a general sense, I must say that you are painting a much more optimistic picture than my experience would justify. But I'm reassured. So it probably is better than I thought it was. Those data collected, however, have a terrible landmine in the bottom of it, because although in theory there is a protection for it, actually it isn't really protected, because anybody who wants to get health insurance, for instance, has to sign a form that they agree that all their data will be divulged before the insurance is contracted. And God knows only who else has access to these data. So I have a great deal of doubt that this is done the right way. But Sweden, however, I also have a question. How come the medical profession tolerates these conditions? Because here in Hungary, the medical profession goes to Sweden to get better pay and everything is fine. But where do the Swedish practitioners go when they are fed up? How can they tolerate the conditions there?
That's an excellent question. And I have a personal answer on this question, which is a very dark picture. Because I'm not a great admirer of the doctors as a whole. Because when you look back on the history of the 20th century, you can see that doctors have been very supportive for the dictatorships. Actually, the Nazi Germany was a medical project. And if you look at the number of party members, the number of SS members and so on, the medical profession was the number one on all fields. They had the highest relative number of party members and the highest relative number of SS members in the medical profession. And it's the same thing in communist countries as well, that the doctors have been very supportive for. Somehow, the doctors still believe that they can make a career somehow, and then they have to be very polite against the power, the representatives of the power. And that will paralyze them in this kind of fields. The Swedish Medical Association has not achieved anything in the last 30 years for the doctors. No, yes, but I mean, this is something that's general or quite striking to see this kind of behavior. That's my personal view. Otherwise, I have no objective answer on this question.
In quickly answering to your question, whenever I get a form from an insurance company, you have no choice, I have no choice, I have to submit everything that's in my medical records. On the other hand, if I share things between colleagues, I can filter that. So there's filter on that. But once I get something from, like you said, the insurance company, I don't have a choice. If I withhold something, you will not get insurance, or the policy won't be valid. It's almost like an affidavit. I have to comply.
Good morning. My name is András Santo. I am not a doctor. I have nothing to do with medicine. I am from time to time a patient. I have one remark and one question, and this relates to the Swedish experience. And your remark, sir. I have no statistics on the behavior of doctors in Hungary during the so-called communist era, but I have always had the impression that doctors used to be the less politicized, one of the less politicized part of the population. But this is a subjective opinion. Concerning my real question, or the question, you have dwelt in detail about the shortcomings of the management system that is in place in medical institutions in Sweden. If my understanding is correct, then these institutions are run either by the state, by the central government, or the local government. At least run, not necessarily owned, but run. And here comes my question. In all the countries, especially in the developed countries, there are so-called state audit offices, state audit agencies. In the US it is called the General Accountability Office, that are famed for very good quality work. And since these institutions are in Sweden run by the state or by local government, one would assume and presume that the State Audit Office or the Royal Audit Office of Sweden is from time to time paying visits to these institutions and performs management audits. So how come that these management audits fail to reveal the shortcomings you have been mentioning about? Thanks.
Thank you for your question. It's a very relevant question. All the hospitals in Sweden are owned by the local government, by the county council. And there's not one single state-owned hospital, not even the university hospitals. And this reform took place about 30 years ago, and it's not very good. They want to remake the whole system and return the university hospitals to the state because it was working better. And there are some objective controls. I don't know exactly, actually, to tell you the truth, what the name of the institution is. They are checking very many things, and in very many things they are excellent. They are very clean, they have very low levels of secondary infections and so on, and this way it's working well. But the production rates are extremely low because of all these things. I mean, the occupancy rate is so outrageously low in the wards that it does not make sense economically. And they have, that's the disadvantage of democracy. They are responsible every fourth year for the voters. And the voters don't know anything. They don't even know which party runs the county council. They don't know it. Everybody knows the government, the central government, but who is running Budapest? Most of the Swedish voters don't know it. And they are not so politically active as the Hungarians are. And that's why they cannot, most of these politicians are not responsible for they don't feel responsible for these things. So yes, controls are there. There are no outrageous problems in the hospitals. The fire alarm is working and so on. The elevators are working, but patients are not there. I could show you around in our hospital, which is gigantic. Karolinska Hospital is in two parts, of the two ends of the city. My part is bigger than the old town of Stockholm. And at 1 o'clock on a Friday afternoon, there's not one single outpatient left in the hospital. Why? Don't ask me. Yes. And how come that the managers don't have to answer these questions? Moi, je ne sais pas. And that's exactly the reason for the decline, because they don't see these things. There are certainly a lot of things. You can put Sweden as number one still. There are many, like deliveries and neonatal ward, and there are some other things as well. So if you put just those things, then it's okay. But the cost of it is outrageous. The OECD had a study a couple of years ago where they compared the quality of the healthcare to the money it cost. And Sweden became number 36. And number 35 was Colombia. So that's the problem. That's the problem with the taxpayers' money, that you are not responsible as a politician. And that's why the Canadian system with the private producers is better. And 15 years ago, there was absolutely forbidden to have a private hospital. They are coming all around the country because because they are better run economically.
I'm not sure if the Canadian politicians are any more responsible than the ones you have. I haven't found one yet.
Good comment. Yes, please.
Yeah, my name is Csaba Szokori. I'm a medical doctor by basic training, but right now I'm running Mölnlycke Healthcare in Hungary. It's a healthcare company. Actually, I have a question. On one slide, it was appearing prevention. And both of you are working in a so-called socialized healthcare system. And personally, I do believe that prevention is a very important part of healthcare, in the modern healthcare, and can save a lot of money. If we are talking a lot about economics. And if I recall my history back in the good old communist times, they're good, I'm joking about that, but the communist times in Hungary, when we had a very strict chest screening and other screening systems, it made some results. Today, the compliance of the screening is very bad, even in Hungary and in many other countries. And I'm just wondering that what is your experience in Canada, in Sweden, that are these socialized systems are focusing on prevention or screenings? Are they spending enough attention? Are they advertising it? Are they penalizing patients who are not going to screening? So what is your opinion and what is your experience with prevention and screening?
If you don't mind, we have very strong screening protocols implemented. You've touched on a couple of things. One is the screening itself, and the second on how about the patients. Unfortunately, in Canada, there's no patient accountability. That's a problem. And patient accountability is something that hasn't been addressed either by the medical profession nor by the government. It's one of those political footballs nobody wants to kick, because if the government wants to make the patient responsible, it would mean the patient would lose certain benefits. Let's say if you have a bad chest x-ray, you continue to smoke, then I have to withdraw some kind of benefit from you. Government doesn't want to do it, you're losing votes. By the same token, the doctors can implement this without the help of the government. So patient accountability in Canada is not there, and it's a huge issue, and certainly it's an issue with me. And I agree with you 100% in that prevention's where the money is, because you better spend $1 preventing, otherwise you spend $10 treating. We have these preventive programs implemented again through primary care. One of the things that they have done in Ontario was they have introduced incentive payments. What does that mean? It means if, for example, we have various chronic care disease management. One of them, let me give you an example, is diabetes. If I see a diabetic, let's say 2-3 times a year, and if I get them on target, I get remunerated for that. I get extra money. So there's incentive for me to see a diabetic. In the others, in vaccinations, we also get incentives. We also get incentives in a couple of other areas. So that helps. Having said that, incentives help only in the beginning, but unfortunately studies show that by giving doctors incentives, on the long run, it works in the beginning, but then it fizzles out. But I agree with you. prevention, I think, is where you should be putting your money. And again, I mentioned to you about the continuum education, and again, the college come and check our practices. That's again another incentive. Otherwise, I can lose my license, I get suspended, so on and so forth.
Well, prevention is working very well. Prevention is working very well in Sweden, actually, because the leading institutions, the governments or local governments are offering most of the evidence-based screening methods. I say this way because I'm not quite sure that the mammography screening should be run the way it is run, because it's a very high irradiation dose which is given. And a woman shouldn't start doing mammography once a year or once every second year from the age of 40, because then she will get some other kind of malignancy. But otherwise it's working well. It's implemented either by the general practitioner or some centralized place at the hospital. And just since I'm a pediatrician, I can say that about 95% of the Swedish children are vaccinated against measles. And the only exception are the Jehovah's Witnesses and the anthroposophes. They are not vaccinated, but all the other people are vaccinated, and the average population is very thankful, and they go and follow the instructions. So it's working well. But it's very, very free. It's a democracy, and it's very important that nothing is compulsory. So it's up to you whether you want to do it. I've never heard about any case of yellow flag, something. Maybe sooner or later it will come, but not yet.
Thank you very much. It's time to have a coffee break. I encourage everybody to go on with the discussions, and we will meet here and go on with the program within 15 minutes. Thank you. Thank you very much.